Good morning everyone. Today, we are going to delve into the exciting world of teaching evidence-based medicine. Teaching evidence-based medicine is a crucial skill set that you will carry throughout your medical education career.
Good morning, Professor. I have heard that we need to teach EBM in an effective way, but I'm not exactly sure how it will be effective and how we can encourage students to make it fits into their everyday clinical exposure.
That's a great point, and we'll explore that today. First, you need to keep in your mind that to effectively teach evidence-based medicine you need to apply adult learning principles, and this session aims to provide step-by-step guide to teach evidence-based medicine. Let me take you in a journey of a young faculty member with his students, who took a round in the hospital medical ward. Their case was a 75-year-old woman admitted with community-acquired pneumonia. She responds nicely to appropriate antibiotics, but her hemoglobin remains at 100 gram per liter with an MCV of 80. Her peripheral blood smear shows hypochromia. She is otherwise well and is on no incriminating medications. We contact her family physician and find out that her hemoglobin was 105 gram per liter 6 months ago. She has never been investigated for anemia. A ferritin has been ordered and comes back at 40 millimole per liter. We are unsure how to interpret a ferritin result and don't know how precise and accurate it is. Before continuing the journey, I want to remind you that each step of the EBM process demands a specific level of knowledge and skill, ranging from constructing structured questions and conducting literature searches to critically appraising evidence and communicating results effectively. Let us see how our journey champion do it. In step 1, my champion started with encouragement of his students to identify the knowledge gap and to formulate a clinical question using PICO, starting with explaining the importance of using PICO, then providing some examples. Later, he handed out PICO structures as educational prescriptions for each student to use them to analyze the previously discussed case, and finally, he asked students to work on answering those questions and to meet again to identify the knowledge gap. In the second step, he advised them to start looking for evidence, searching for answers through literature searching. He taught them the hierarchy of evidence levels, emphasizing on the importance of reputable sources and selecting the appropriate terms for search, explaining the difference between the use of natural language and controlled vocabulary. Here the faculty member encouraged more experienced trainees to guide and help their peers in small group activities, guided trainees to seek support from local medical librarians, promoted independent search skills, empowered them to develop and document their search strategies. Then he closed the learning with the case-based discussions, acknowledging progress, and providing positive reinforcement. In the third step, the faculty member started the step of transferring research knowledge into practice, empowering students to systematically examining research evidence to assess its validity, results, relevance, impact and applicability before using it to inform a decision. He emphasized at this stage on using the quality checklists based on the study type and setting up a journal club with the aim of presenting critically appraised topics or articles. To connect the exercise into day-to-day activities and goals as a part of adult learning principles. In the fourth step, my champion empowered students to execute the application of results, taking into account the patient clinical circumstances, choices and values. Highlighting that the transfer of learning for adults is not automatic, it must be facilitated. Therefore, I want you to keep in mind that coaching and other kinds of follow-up support are needed to help adult learners transfer learning into daily practice so that it is sustained. Initially, the trainees should observe their seniors and learn how to integrate evidence into patient care. Organizing small group activities to practice this step is an excellent way to develop this skill and help trainees to be confident in interacting with patients in real life. In the next step, trainees should be supervised by the trainers and to be given regular feedback so that they become fully conversant in the art of integrating EBM into clinical practice. In step 5 of evidence-based medicine, EBM, trainees are encouraged to play a bigger role in evaluating current practices in light of newer evidence. Trainee presentations in journal clubs or clinical meetings are suggested as platforms for discussing and disseminating new evidence. When new evidence suggests a change in existing practices, as a teacher he used to guide trainees in identifying potential areas for change within the organization, taking local issues into consideration. He involved his students in identifying outdated guidelines, focusing on areas where small changes can be quickly implemented, encouraged trainees to prepare new guidelines or revise existing ones, empowered them to participate in audit and guided them to incorporate evidence-based criteria in audit, supported them in presenting the audit findings to key stakeholders and acknowledged their effort.
By combining these teaching methods, you can create an engaging and effective learning experience for trainees, aligning with adult learning principles and promoting the application of evidence-based practices in healthcare. Thank you. Continue to the next session on competencies assessment.